Meet baby Chloe, a beautiful, happy 5-month-old born after a normal pregnancy and birth, to the delight of her parents and big sister Melina. But Leanne Souza soon realized there was something wrong. She was diagnosed with the rare genetic disorder SMA, spinal muscular atrophy.
I would say about a month old, I noticed that she wasn't moving her legs very much.
Chloe now has trouble holding her head up and raspy breathing because she doesn't have the muscle control to swallow.
We've been really cautious with her eating because severe cases of SMA, especially in type 1s, swallowing and breathing is very hard on them.
For a couple of years now, the drug Spinraza has been used to treat SMA. At a cost of hundreds of thousands of dollars a year, it was known as the most expensive drug in the world until now. There's a new drug on the market that could dramatically improve Chloe's life, but it costs $2.8 million Canadian. It's called Zolgensma, made by Novartis. It was approved in the States in May, and most drug plans there cover it, but it's not available here.
Families that we've spoken to in the U.S. that have had their children, they've been able to get this drug. Their children are thriving. It's just not fair, and something needs to happen. The government needs to kick in and help these families, help these children. They're helpless, they're innocent, and they deserve the treatment that they need.
Chloe's family is not the only one to be faced with this impossible task of trying to come up with nearly $3 million. Leanne knows at least 3 others in southern Ontario. All are trying to raise the money through a GoFundMe page, including baby Eva Batista, who's been lucky enough to raise close to $1 million. But baby Wyatt Vasey is only at $37,000. Chloe's parents are at $53,000.
It's amazing. There's so much good in this world, and we've been shown so much support, but it's just
a drop in the bucket.
Yeah.
Leanne tells me she's running out of time. Zolgensma needs to be taken before the age of 2 in order to be most effective. For now, she can only hold her baby tight and hope and pray that something changes.
Ever since we've been diagnosed, I don't want to let her go. I don't want to leave her out of her sight. I stay at home with her. I don't like to put her in her crib at night.
I'm sure.
It's really hard.
It really is a heartbreaking dilemma, and the company Novartis has defended its exorbitant price tag by saying, in part, that it's actually less expensive than a long-term treatment like Spinraza, which a patient has to take for the rest of their lives. But Cynthia, of course, you know that is of no comfort to these desperate families. How do these companies get away with charging so much?
Well, Pam, that's been a long-standing controversy. Now, these drugs for rare diseases are called orphan drugs because so few people need them. And they've often taken years to get to market, so companies charge the exorbitant prices to try and recoup the money that they've invested into them. Now, it can take a painfully long time for an orphan drug to get approval here in Canada, but it also raises the ethical question. How much is too much for a company to charge for them? Can governments afford them? Can governments afford not to give them to people who need them?
Tell me about your daughter.
Oh, she's amazing. I would do anything for her.
2 years ago, Julia Gall was desperate to get her daughter Sophia Spinraza to treat her SMA, which was destroying the muscles in her body. Her parents were told she would be in a wheelchair within a year. Back then, Spinraza was billed as the most expensive drug in the world, $750,000 US for the first year of treatment, and $375,000 after that. Sophia was lucky. She got her first shot after her father's insurance approved coverage.
Daddy, everything's not hurting, everything's not sore.
A week later, she was able to ride a bike for the first time, and she's thriving. Spinraza was approved for OHIP coverage this past June, only 5 months ago, and now there is already a new therapy promising a new miracle for desperate families, Zolgensma, a gene therapy recently approved in the U.S., but not available in Canada. It costs $2.8 million for the one-time treatment, putting hope out of reach for most. But SMA is only one of more than 6,000 rare diseases, and the approval process for orphan drugs in Canada can't keep up with demand. On its website, Health Canada acknowledges it has to do better, saying it has made a commitment to improve access to medications. These are all the drugs currently being considered. There are 20 pages of them. So far, the manufacturer of Zolgensma has not asked Health Canada for approval. Once a drug is eventually approved, though, it has to go through another lengthy process by CADTH, the Canadian Agency for Drugs and Technologies in Health, which has the brutal task of deciding if the cost of an expensive drug is worth the benefits. Then it's up to individual provinces to negotiate the price with the manufacturer. All the while, people like Leanne Souza, who's trying to get her daughter Zolgensma, wait and hope in desperation.
You know, if everyone in the U.S. can get it right from birth, why can't we as Canadians get it as well?
Now, in the U.S., orphan drugs are fast-tracked for approval, so they get to the market faster. The U.S. also provides incentives to the manufacturers to make these drugs. During the election campaign, Justin Trudeau promised to create a rare disease strategy and try to bring the cost of these drugs down.